Welcome to the Heart of Melbourne Cardiology Quick Q&A number 2. What are the challenges of managing heart patients with renal failure? With Associate Professor M Asrar ul-Haq.
The ischemic heart disease can be a big problem in kidney patients because the kidney patients often have a lot of calcium in their arteries, and it becomes hard and it becomes quite difficult to treat these type of arteries. Now, the other problem we get is often that the kidneys are already not functioning at their best. And when we have to do the angiogram or put stents in, we have to use contrast, and the contrast can hurt the kidneys more. Now, this is a very catch-22 position, because to save their heart, we have to use the contrast, which can affect the kidneys and make them worse. So sometimes I have used some special type of technique we call as intravascular imaging. We take photos from inside the artery. So instead of using contrast, we use an ultrasound type probe, and we put that in the artery, and we take using that ultrasound, we put the stent in, we measure how big the stent needs to be, where it needs to be put in, and then we put the stent in. We inflate the balloon inside the stent to make it to stretch it to the walls, and then again with the ultrasound we can check if the stent is working fine and if it is well inflated. Now, this saves us from having to use the contrast, and this is a big save to the kidneys, because now these kidney patients can have their procedures and the treatment without having to use bucket loads of contrast and have long-term effect on the kidneys.
Is it safe to perform angiogram in chronic kidney disease stage 4 and 5 if the patient is having chest pain?
Usually the first test that we ask for is a stress echocardiogram, in which we make the patient walk on the treadmill and then scan their heart with an ultrasound or the echocardiogram, and see if there is any significant abnormality in the contraction of the heart associated with exercise. That can give us a lot of answers. But often the patients are not able to walk as much as we want them to walk to get good results of the stress test, so we can send them for a nuclear perfusion scan, in which we can give them medicines to test the heart and then scan the heart with the help of nuclear technology. Now, the limitation is sometimes these non-invasive testings can be non-diagnostic, or if they are positive, then we are again stuck. So in which case we can use minimal amount of contrast to do the angiogram, which we call as minimal contrast angiogram, to get all the diagnostic information, and then if the treatment is required, we can stage it to another time to minimize the contrast usage in one sitting. And then if we need to treat the arteries, then we can use the ultrasound inside the arteries instead of contrast, to have zero amount of contrast usage in the procedure when we put the stent in these patients.
Does calcium in the arteries pose any special challenge to the stent procedure?
Sometimes the calcium in the arteries of the heart can be a real big challenge, because to put the stent in, we have to break that calcium, and it can be really difficult to do that. Often we have to drill through that calcium using a special drill machine to be able to put the stent in. Now, that's a high-risk procedure, but we often have to do it. Now, there's a new technology called lithotripsy. It is being used in Europe and America, but it is very brand new in Australia. It is being used very selectively by few operators at the moment. At Heart of Melbourne, we have treated our patients with lithotripsy, which we, using the ultrasound waves inside the arteries of the heart, we can break the calcium and put the stent to a very good effect.
Is it similar to using lithotripsy with kidney stones?
It is a technology which is similar to the lithotripsy that they have been doing in kidney stones. Is slightly modified for the heart, but it gives excellent results. This technology is less risky than the traditional rotablation or rotational atherectomy, which is the drilling inside the arteries to make space for the stent.
Can you briefly explain optical coherence tomography?
This is very high resolution imaging inside the arteries, which we can use before and after the putting the stent in. It will tell us the results of the stenting. The idea is to optimize the results of the stent to have good long-term outcomes. If the stent is with experience, we know that if the stent is well opposed to the wall of the artery and it is stretched to its maximum potential and there is no waste inside the stent, it gives better results in the long term. Using this technology, we can check the stent after putting it in and make sure that we have the best possible result for every single patient.